So I was originally, and still am, an internal medicine doctor. I've worked in pretty much every aspect of internal medicine. Yeah. And that's probably one of the biggest.
I mean, you have the happiest staff I think I've ever met. I mean, seriously, from the time we walked in, seriously.
The front.
And trying to support women to feel their best. We do a lot of hormone replacement for perimenopausal women. We do some weight management. We do IV therapy for those who need significant micronutrient replenishment.
Hey, I'm Jamie.
I'm Ammari.
And we're just two
trying to make it.
Here at Embody.
Oh, it's beautiful.
Yes, my girlfriend Amanda works here.
Wanting to
so
check out this
excited
place.
to check it out. It's gonna be amazing.
Oh my
gosh! So today we have to get our blood work for next week to see what they say. So
I am looking forward to this so much.
yes, it's going to be amazing.
Hey, ladies.
Hello.
Thank you. All right. Hi.
How are you?
I think we're headed this way.
Yes. Okay.
We've been told to see Nikita.
All right.
Hi. How are you doing today?
Okay.
How are you guys?
Good.
Okay.
So we're getting our blood work done today. Can you give us a little insight on why it's important, like for self-care?
Yeah, so
Where
we're
do you
gonna
start? Here.
draw your labs, and then it's going to kind of break them down for our providers to look at them to let us know like if anything's elevated or anything's low, and then we know how to supplement via or hormones, supplements, just kind of to see what your baseline is.
Yeah. Okay, that makes sense. Yeah. So it's really tailored to each person then.
Yes. We can't use somebody else's
Incredible.
symptoms and everything for you. They go off of your labs and your symptoms to develop a plan for you.
Oh, okay. Yeah, that makes so much sense.
All right. So I just need you though to verify that this is your name.
Yep.
And your date of birth, and if it is, I just need you to sign here.
So how long have you been at Embody?
I started last December, so I've been here right over a year.
Oh, nice. It's so cute in here.
I love it.
I was gonna say, I just feel like everybody's so happy
To
and
go anywhere else.
yeah, it's beautiful.
Changing lives. Right. So you prefer this arm on this side?
Yeah.
Okay.
Do you have a side that you like usually
Yeah,
prefer?
don't you?
No, I totally do. This side always rolls, and I try to tell people, and they're like, oh, it'll be fine. And then they stab me like 4 times. And I'm like, in tears, I'm like, can we just do this side, please?
No, this should be one and done.
I know. Thank you, Ammari, for talking about that before.
Oh, sorry. Yeah.
Purpose there.
But I try to be upfront with people. I'm like, please start on the side. I'm telling you, I don't know. What causes rolling veins? Like, what causes that?
Nothing in particular. Just some roll, some don't.
Yeah. And they'll try. I'm like, I'm too polite to go, okay, can we? So I'll just let them stab me 4 times. I'm like, my veins roll. Can we go on this side?
So do you do this all day long? Is this pretty much what you do, or you have other things you do too?
I am. I'm a patient care coordinator here. I do
Okay.
labs when needed.
Okay.
And I'm also a nurse, so I do our injections and our IVs here.
Nice.
Oh, okay, great. And she's
And
a pro.
Can you all get IVs for?
We do immunity, we do migraines, PMS, a reboot. What other ones? There are a few more in there as well. But people get them for preventative, or if someone's sick and you get an IV, it really just gives you a lot of fluids and then the vitamins that you need to get better.
I love that. I'm always so vitamin D deficient.
Still doing okay?
I take
Yep,
a D
I'm good.
supplement every day, but
You're doing good.
yeah. No, she's a pro. Are you
Yeah.
kidding? She like knocked that right out.
Yes. So people watching, this is fine. Come get your shit checked out.
Yes. And I love how you said you kind of need to know where you're starting to know where you
Yes.
want to go.
And we'll draw labs that your normal doctor really won't draw.
That's what I was curious about. Like, so
Yeah.
this pulls like different things. So they can't be like, oh, well, we've had our blood work. No, not like this.
No, we are doing hormone panel, thyroid panel, CBC, CMP, vitamin levels. I'm trying to think of what else.
I love that.
So you really do change women's lives. Like you just,
Yes.
that's amazing.
Absolutely. All right, just keep that on for a few
All right.
minutes, okay?
Thank you. I survived.
Yeah, next up. I'm a little better on this side if that's okay.
Yeah, I'll just
Okay.
move all my stuff over there.
Yeah, she'll just move all that for you, princess.
Sorry.
It's okay. All good. Whatever makes Ammari happy.
And then just your name and date of birth here.
3088. Yep, got
That's
it.
right. Just sign on that line for me.
Yeah. Oh, my pin's not working.
So obviously you look for stuff with like our age range, right? Like me and her are both 36. Like you look for things in our, like, what should we start to worry about at that age?
Yeah, and I mean, we can do preventative as well. So say your labs don't technically show something that's deficient. If you're tired, or you're having highs and lows, like we can prevent that, or like try to level them out before it gets too bad.
Which I feel like the highs and lows really started with me in my 30s. Like, and
no,
but not sleep.
absolutely,
Like, when you're in your 20s, you sleep all the time, life's great, and then your 30s is a wake up call.
And I sort of feel like at your regular physician, they're like, oh, you're within range, but you're like at the bottom of the range, and you're like,
So, yeah.
can we do something to make it better?
There are ranges. I mean, they can still be optimized as well.
Yeah. Nice. I was talking to Jamie on our way over. I have had such hormonal acne in the last like 6 months, like out of nowhere. So that's something I'm really interested to see if my blood work can tell me about my hormones and how they've kind of.
I'm so sorry that you haven't aged as much as me, but you have acne, you poor little thing.
I know. Jamie, it's a problem.
It's a problem. Real world problems here, people.
And I'm a picker. Like, I can't. My SD, hi, Brittany. She just had a baby, and she's like, please, I'm going on maternity leave. Leave your face alone. Like, don't touch it. You're making it so much worse.
Which is why you're doing that crazy facial, right?
Oh, yeah, I'm getting my face peeled off.
Nuts.
Yeah. Yeah. You look so cute today. I love your little jean skirt.
Thank you. I wasn't sure. I bought this last year. I'm like, a jean skirt's still in?
Yeah, they are.
Okay, that's fine.
You're working it.
It's fine. I just cannot get over how cute this place is.
Oh, it's amazing.
Do you guys hear that from your clients all the time? Like,
Yes.
It's so cute.
I say I love it. I don't know if you've been in the bathroom yet. We have a
Flamingo wall. Yeah, I did take a selfie.
Oh my god. We need to go in there and take a selfie for our story
Yeah.
before we leave.
That's why it was taking me so long in there. I was like,
Oh,
I
jeez.
have to take a picture in here ASAP. She's such a pro. Guys, they are pros here. Hardly felt a thing.
Yeah, it was a walk in the park.
She's on it.
Also very informative. I like to know that like you have all my answers for my questions because I like to know a lot of things. I get nervous about going to the doctor. And I felt
Comfortable,
awesome. Yes. The whole time.
Just wait till you sit down with our providers. They're even better.
Oh,
They
nice.
don't dismiss you.
That's huge. I feel like that's huge in
You just want to be
the.
listened to.
Do you have a physician that you like love?
Me?
Yeah.
I've had Dr. Rivera my whole life.
Yeah.
Yeah, is that who you still?
No, I go see Dr. Hopkins. I don't know if we can say that. Is that like HIPAA?
Can't say your doctor. It's our doctor.
I don't know.
We're not telling.
But can I tell you something? He's kind of cute, and he knows this, so I can tell this story. The first time I met him, he like came in the room and he like took my pulse, and he's like, "It's a little elevated," and I go, "That's because you're touching me."
Oh my god. God help me.
And
That is
he
hilarious.
started laughing. He's like, "No, stop." He had to leave the room, and a nurse had to take it, and it was fine. It was totally fine. And he goes, "It was."
Oh my
He's like, "You are ridiculous."
Oh my gosh.
So now
Not
my
the
husband's
same
like,
people here.
"What are you getting all dressed up for your doctor's appointment for?" I'm like, "You mind your business." I'm gonna go see Dr. Hopkins.
That's hilarious. Thank you, ladies, so much. We can't wait to come back next week and get our results.
Yes,
Thank
good
you.
to meet you.
Too.
Right.
All right, guys, we are headed out, and we'll see you next week and find out what they found out. Oh my gosh, is it the most beautiful day ever today?
Oh, it's gorgeous out. St. Louis spring. You think it's gonna last?
Yes. Hello and welcome to Embody.
Hi.
We're so excited you're having us
Two
today.
ladies in today.
Well, we're gonna do some interviewing, and we also want to see how our blood work went.
Awesome.
Yes.
You're here for your new patient consult. How exciting. And
Yes.
your names?
Jamie Corman.
Okay.
Ammari Bourgeois.
All right, so nice to meet all of you.
Mine was not as fancy as hers. I apologize.
Well, let's get you started. Have you ever done an Embody before?
No.
Well, come around the corner. We're going to show you what we are.
Okay.
Who would like to go first?
I'll go. Get it
All
over
right,
with.
Jamie, go ahead and have a seat on the bench.
Okay.
Anything you don't want weighed with you, you can put on the table or on the hook up here. We're going to slide off your shoes.
Oh gosh, my toenails are not painted. Do not get.
Not for free, no.
Yeah, disgusting.
And we're going to take a wipe.
Okay.
Wipe your hands and the bottoms of your feet. This is to get a good read on the scale.
Okay.
And when you're done, there's a little tiny trash can in the corner. You can just toss it in.
This is so neat.
Yeah, go ahead and
Okay.
climb on.
Okay.
And we're going to make sure that the back heels are on those back sensors.
Okay.
First, it's going to measure your weight, and then we're going to put your information in and complete the rest.
Okay.
Weight measurement is
Right,
completed.
and I'm going to put your initials. It's JK, right?
Yes.
And your date of birth.
3/23/88.
And your height.
5'1".
Ooh, and mighty.
I know. I am 36.
6. Oops, wait, 5'1". Let's go there. 36. All right, here we go. Just give it just a moment.
Okay.
It's going to ask for you to grab those handles in just a second.
Okay.
Okay, you're going to grab the handles and place your thumbs on the oval sensors and
Okay.
then arms straight out away from your body. Just like that. And give it all just a few minutes to read, and then it will print out when it's finished.
Wow. And you all are the only one in the area with this this machine. It's so neat.
Do not talk or
And during it, she's
during
very
the test.
quiet. It tells you she's very sassy. She tells you to stop talking.
Oh, are you?
The test
Jamie, you
is
can step down
completed.
safely. You
Okay.
can slide your shoes back on.
All right.
Now it's going to be Ammari's turn.
Thank you so
You're
much.
very welcome.
I wore boots today. That was a little more complicated. We'll tuck it over here though.
Okay. There's your
And every single patient uses the scale.
yes.
Nice.
Come in and it tracks your progress. So each time you come, it will show what you had previously, and it tracks it.
That's
That is
awesome.
so nice. Because you know what? I mean, I go to my regular physician maybe like once a year, twice a year, and it's hard to be like, well, what was working in that year's time?
I'm going to go ahead and scan this when we're all done, and you'll get to keep a copy of
Okay.
it for today. And we'll do
Okay.
one. We'll get hers ready. All right. When you're ready, go ahead and climb on. Be careful when we get on.
Okay.
Yep. And give it a minute to measure your weight.
Do not grab the handles or move. Weight measurement is completed.
On this side this time. And your initials are A. What's your last initial?
B bourgeois.
Okay.
There we go.
And then date of birth.
8/30/88.
And then your
Your
height.
personal
5'3".
Oh, bragger.
I know. 36.
36. Okay, we got you in there. Give it just a moment, and it'll ask for you to grab those handles in just a second.
Okay. I think it might be 5'2.5".
Go ahead and grab the handles, thumbs on those oval sensors, and arms straight out away from your body.
Like that?
Keep your arms straight. Your arms must not touch the sides of your body. Starting your in-body test. Do not talk or move during the test.
This is a lot for Ammari not to talk. So
She's doing a great job.
we're going to bring the scale along with us sometimes.
Oh, there.
No. Only kidding. We love Ammari. She keeps us alive and moving.
All right, you can step down safely from
All
there.
right.
We'll
Easy
get your copy and
peasy.
scan it also, and this will be part of your visit today.
Thank you so much.
You're very welcome.
That was so easy. No, I agree. I do need to
Oh, stop. I love
zip
it.
it sometimes.
I love it. You make up for all my dryness.
You are
and
good.
keep the conversations
dry.
moving.
You're not dry.
Can I get you ladies some water or anything before you
Oh my
head
gosh,
back?
that would be lovely.
Yes, I'll take one too. Thank you.
so much.
You bet.
Okay. Boots back on.
Yes. They're cute. They were worth it.
Exciting. So I'm so happy that both of you are here and kind of getting started on your wellness and self-care journey.
Yes.
Super, super important for busy moms, business owners, entrepreneurs to make sure that you're taking care of yourself. You can't fill from an empty cup, so you have to make sure that that foundation for health and wellness is set before you can give more of yourself to anyone else. That's where we come in.
So true.
I feel like that's where I struggle the most.
Yeah,
Give, never fill the cup. So I'm eager to hear what these say.
Yeah. Ooh, let's get into it.
A little nervous.
Maybe first we should introduce. This is Amanda Eversgerd. Am I saying this name correctly?
Eversgerd.
Eversgerd. Yep. Hi, everybody. This is Amanda Eversgerd.
Yeah.
Do you want to tell everybody a little bit about yourself?
Yeah, so nurse practitioners. I worked in a trauma ICU as a registered nurse. Left that, did school nursing for a while, became a nurse practitioner, worked in family practice for several years, and then got asked to come along on this journey with Embody Her Health to kind of specialize in delivering care to women and specializing in women's wellness, and haven't looked back. It's been the greatest decision I ever made.
Do you feel like you have a passion for it?
Absolutely. Yeah, I think that the passion started in primary care because I think that there's so many disparities faced by especially middle-aged women. You know, we're kind of beyond those reproductive years where we're very well served by our OBs and our GYNs. And when you're post-reproductive years, it's kind of like, well, okay, great. See you later, right?
Which is really kind of sad. I feel like that's kind of the struggle that everybody feels whenever that part of our life, you know?
Yeah.
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 Changing and forgot about.
Definitely saw that in healthcare in the primary care setting, you know, not intentionally. It was just that there were very limited options for the concerns that were facing women as they kind of navigated that part in their life. So, you know, here we like to start with blood work and kind of identify whether there's any deficiencies or any kind of major concerns going on, and trying to support women to feel their best. We do a lot of hormone replacement for perimenopausal women. We do some weight management. We do IV therapy for those who need significant micronutrient replenishment. So, yeah.
And who benefits from that?
Yeah, so anyone can benefit from IV therapy. It really is something when you're feeling run down or you have a particular concern, like your immune system feels run down or you're getting ready to travel. If you have certain goals, low energy, you know, you can benefit from IV therapy, and certainly those with significant magnesium or B deficiencies could definitely benefit from having that robust replenishment.
D over here. I'm always D deficient.
I
had an office job for forever, so you like go to work really, really early. You know, you don't get very much sunlight, and come home at night. You know, so I'm always super D deficient. I try to supplement it, but I love that you kind of like address the gaps, and it really feels customized to each person.
Yeah,
which is amazing.
Yep, definitely the goal. Definitely the goal to feel heard, supported, and you know, I think for me, when we first started, we just had so many patients coming back and saying, I told my sister she's coming in to see you next week.
Oh, people rave about
my
you.
friend is coming in to see you next month. Oh, so-and-so is coming in. Oh, I found you on a Facebook mom
They
group.
and they also think that your guys are like celebrities. Seriously. No, I'm not exaggeration.
Definitely not go that
Not
far.
exaggeration.
I feel very celebrity.
Employee, and she's like, I saw that you're going to Embody Health. And I was like, yeah. She's like, well, I have a gift card there, which I guess you guys do gift cards. She got a gift card for Christmas.
Yeah.
She ended up having some health stuff and was not able to get to see you guys yet. But she's like, I can't wait to hear all about it. Can't wait to see all of it. And I was like, no, even I'm like, my friend Amanda, like, I've known her for a while. And she's like, really? And I was like, I can't wait. And I'm like, gosh.
No, even my nail girl. I came here from my nail appointment, and Michelle Vo, she goes, you're going to see Amanda.
I had no idea that my friend was such a big deal. I mean, I love her, but I'm like, gosh, that's awesome.
It feels far less glamorous than that. Very, very non-celebrity status. But it's very fulfilling, you know, to feel that, to have somebody come back and say, like, you changed my life for the better. You know, my relationship's better, or I'm functioning better, or my children are noticing that I'm not snapping at them anymore. You know,
that's huge. I mean, the girl that drew our blood last week, she told me, she's like, I love changing people's lives. And that was so emotional for me because that is such a amazing thing to be able to make women feel good, because I feel like as moms, as working women, as just everything, we just feel so unappreciated. And like we have not to say nobody, that's terrible, but
You have to
just
do it
like,
all, yeah.
you have to do it all, and like it stops with you, and you got to figure it out, and knowing they have a safe place where they can come and feel heard and get the help that they need.
Yeah, get recharged.
Yeah.
Okay, well,
Yeah.
you want to get into the nitty gritty?
Yeah. So let's kind of look at your labs, Ammari. So overall, we check a couple of different things. So we start with complete blood count, comprehensive metabolic panel. Yours both look really good, so no major concerns there. We also check a cholesterol panel. Now, a very slight increase in your cholesterol levels. So your total looks fine, but your LDL is a little bit elevated. Your HDL is marginally elevated. We do some more advanced testing. We're not completely bound by what your insurance will allow us to test. So we can go a little further than what your PCP can, which we really love. And we look at some advanced lipid profile. And when I look at yours, you may have a little bit of an increased cardiovascular event risk. And those things develop over years and years and years. So it's good to kind of be on the forefront and preventative with that. You know, I would definitely recommend specifically some supplementation for you, and many of my patients will fall into this category. And I think that being in the driver's seat and kind of stepping out with that can be really good. So I would start on some omega-3 fish oils for you.
Okay.
We check some inflammatory markers with CRP. Those are some basic autoimmune screenings. You know, yours look really good. Iron levels, ferritin levels, folate, B12, yours are all excellent. So getting a well-rounded diet or supplementing appropriately, yours are looking good. What you're doing is really serving you well.
Good.
Your A1C, that average blood sugar, looks good. Your vitamin D is in normal range. And then looking down here at your hormone panel, your hormones look normal, right? They look appropriate for a menstruating woman.
This is going to be so interesting because I did just get my blood work done at my primary, and I am having the worst hormonal acne I've never had it. And I'm telling him, something is wrong with my hormones. They're in range. So,
Yeah. So that's the thing. We haven't studied female hormones enough. They're in range, but your hormones are always going to be a moving target. So when you're in your normal menstrual cycle, you're going to see significant peaks and valleys with your estrogen and progesterone levels. So what we're able to check is looking at one moment in time. We never get the full motion picture of how your hormones are behaving. The fact that you're experiencing hormonal acne, well, that tells me your hormones aren't behaving well, right?
I knew it was odd for me. I'm like, this is weird. It doesn't matter what I do. I go get hydrofacials. I'm gonna go
Trying to do a chemical peel.
Yeah, I'm gonna go get my.
I love that. Get a chemical peel, girl. I got you on that one too.
Now we have to be on camera.
I was like, what in the hell are you doing?
But, you know, when we look at that and when we look at these, we have to take them with a grain of salt. My patients' symptoms tell me much more about how their hormones are behaving than the numbers that I see on paper. The numbers on paper help me to know that the decisions that I'm making and the recommendations that I'm making about hormone replacement therapy or supplementation that can help to regulate those hormones, that those are appropriate recommendations. But it doesn't give me the full picture, right? Your symptoms, I need to know what those symptoms are in order to paint that picture and to put all the puzzle pieces together.
That makes sense.
So when we look at that, your testosterone's on the low side of normal. So you're at about a 14. So when I look at kind of what a normal testosterone is, sure, that's in normal range. But a testosterone under 50 is likely to cause some degree of symptoms. And symptoms associated with a lower testosterone are going to be things like fatigue, decreased stamina, decreased muscle mass, decreased libido, decreased mental acuity and neurocognition. So there's some significant symptoms that can come along with a decreased testosterone level. Women, when I start to talk about testosterone,
I hate
often look at me like,
I hate it.
Whoa, wait, why are you talking to me about it?
I know it's necessary, but I hate it. I'm like,
Yeah, and it's been inappropriately gendered as a male hormone.
I agree with you.
Yeah, it's an everybody hormone. Women need testosterone just like men need estrogen.
Good education right here, guys.
Much less testosterone, and men need much less estrogen. You know, so maybe that could be something you would benefit from.
Absolutely.
So then I look at your estradiol level, your follicle stimulating hormone, your luteinizing hormone, and your progesterone. They're all appropriate for a menstruating woman.
Okay.
But again, these are all moving targets.
Right.
So it's hard to gauge. Your estrogen is misbehaving. That's probably why you're seeing some breakouts.
Yeah.
So a supplement used in perimenopause that could be really helpful would be a gym supplement for you that may help to regulate your hormones a little bit and to give you some better results or better control of that maybe hormonally related acne.
Okay, yeah.
Chemical peel isn't going to hurt anything though either.
Oh.
don't let Jamie sway you away from that. Chemical peels? Oh, girl, I do chemical peels all the time. They're amazing.
I've been watching them on TV. Like,
so they're not all created equal.
No, there's intensities to them. Well, I've been watching Intensity and I was shitting. I'm like, you cannot do this. I'm watching this girl for 4 days and she looks crazy. Like she has like a burn victim.
Feeling like a snake.
Yeah. And I was like, you're going to go in front of, like, we're going to be filmed and you're like that? No, he yelled at you for being ashy the other day. Not and he's trying to get a chemical peel. I was like, do not put me in that weird predicament. No.
Get your peel. Peel away. Get it off.
I'm doing it
all
when we
good.
have a week off. Like a nice long...
I'm going to Florida, so taking advantage.
Yeah.
There you go. That's the perfect time for a peel. So, and then your thyroid levels all look good. Thyroid's important. That's going to affect energy levels. It's going to affect our metabolism. So important to rule out that there's any concerns there. Yours are all very well balanced.
Great.
And meet the criteria for optimization. Your magnesium looks wonderful too. Magnesium is a supplement I very commonly recommend for women, but yours looks awesome.
So Ammari's over here being a star. Well, I had definitely, a year ago, it was a totally different story. Actually, for those reasons, cholesterol and just everything was like totally out of whack. I've lost like 60 pounds.
Oh my God, congratulations.
Yeah. So this is like huge for me. I'm like,
oh my God.
Even though there's like still room for improvement, I'm like, okay, great. We're doing things. It's working. But this is why it's important to come.
Exactly.
And see where you're at. But especially the hormones, I'm so excited to explore more and get your recommendations because I knew something was up and they're going, it's not, you're good.
You're good. Yeah. Mm-hmm.
I'm not.
And it feels off. Yeah. And you kind of know that it feels off.
Yeah.
Right?
The hot flashes are kind of starting at night.
It's terrible.
Yeah.
I am so bad in my stomach. It's awful.
Oh, yeah.
Kurt's like, your pajamas are wet. Yeah, no shit.
Yeah.
I'm covered in sweat. Thank you.
Thanks.
Captain Obvious.
Yeah. My husband the other day, I was just like laying on the floor because we have hardwoods upstairs. And I was just like laying on the floor. He's like, are you good? I'm like, yeah, just cooling off.
Well, and when I get my hot flash now, like I get pissed. Like I don't want anyone talking to me.
Yeah.
And when I owned our first big restaurant, I was like 25. I owned Fish House and I had a lady that worked for me. And she'd have hot flashes and we'd always give her hell. And I'm like, I feel so guilty. Like karma is a bitch.
She has to go like staring in the cooler.
Yeah, it's real. I'm our walk-in cooler. I'm like, it is very serious. Yeah. I should have shut the fuck up as a 25-year-old and loved my life at that point.
Have you guys seen the reel of the lady who's like actively flashing and she's out at a football game and literally there's like steam coming off of her head?
No.
Oh my God,
it's real.
It's insane, but it's legit.
It's
like it just physiologically drives you bonkers.
Yeah, and I'm like, why does it make me so bitchy? Like I get pissed. Like I'm like, tell my kids like, quit talking. I need a second. And Camden's like, cool. I'm like, I know, buddy. Yeah. You have no idea what's coming. When your sisters are having their period and I'm still doing this shit, you're going to want to move out.
Oh, yeah. Oh, yeah. I've seen some memes about that too, but they're definitely not appropriate for this. All right. So, Jamie, looking at yours, kind of similar profile that we went through here, your complete blood count, your comprehensive metabolic panel with your liver and kidney function all look great.
Okay, good.
Your cholesterol is also showing a little bit of elevation there, so I would definitely recommend some supplementation that's geared towards cardiovascular risk reduction, like an omega-3 fish oil. This is not an uncommon finding, especially given the fact that you run an amazing catering business and are always, kind of
So what's the risk if I don't?
Yeah, so cardiovascular event risk and atherosclerosis, that is kind of where you see that plaque formation and you're at a greater risk for heart attacks, strokes, and that sort of thing. So
I need to take it kind of serious.
Yeah, it's a big deal. Yeah, it's not something that occurs over, months. It's something that occurs over years. It's a cumulative effect. So it's really important to stay kind of proactive about that and making sure that you're making efforts to reduce that risk. The key key things that you can do though, sure, supplementation is important, but lifestyle is number one, right?
Okay, so you're saying like 5 skis a day, not probably gonna help.
Probably not the best thing, probably not the best idea, but moreover, physical activity, right?
Yeah.
Being intentional about getting a minimum of 150 minutes of physical activity per week. And I would even say probably looking towards, as we look at this kind of new era, perimenopause and menopause era, really focusing on like resistance training and muscle strength and building, because that pays dividends in the future, right?
I
That's
know.
the key to longevity and mobility. So the lifestyle is what you can control, right? And that's going to pay dividends in the long run for reducing cardiovascular event risk.
What do you recommend? Like, is like walking, like I love to ride my bike. Like, so if I ride my bike every day, like what is enough? What makes a difference?
Yeah, so about 150 minutes of physical activity per week.
Okay.
But for me, when I have patients who are really like, okay, I don't even know where to start,
Yeah,
right?
that's where I'm
I
at. Like,
don't
what
engage
is
in
enough?
intentional
What is-
exercise. What speaks to you is where you should start.
Okay.
So
Yeah.
if you feel like walking is a good start for you, if you're like, you know what, I could probably drop Cam off at baseball and then I could walk. There's like a little walking path there.
Yeah.
Great. Start there.
Okay.
Do that 2 times per week. And then when that feels good and that feels comfortable and that feels like habit, add another day. Try to integrate another activity until you're working up to that goal.
Yeah.
You know, if you try to make, what I find a lot is that if you try to make really big changes and bite off more than you can chew, you end up failing, right? It ends up kind of backfiring and you end up kind of taking steps backwards and giving up. So accept progress over perfection. You know, that's really the key to making that sustainable
And I
change.
mean, I loved COVID. I'm just going to tell you, because we rode our bikes, we walked because we wanted to get out. We live on the lake and we would drive in and we'd go on the dam, we'd ride our bikes, and like that was our chance to get out. Now we're back to our kids being in every sport.
Right? Yeah, there's no time.
There's no time.
Yeah.
And I hate saying there's no time because there's always time.
Sure.
But maybe I might want to watch my Netflix show.
Okay, so here's one for you. I have a couple of HIIT exercises. This is like tips and tricks. I have a couple of HIIT exercises that I have memorized. So HIIT exercise is high intensity interval training.
Okay.
There's a plethora of them available on YouTube, and a lot of them you can do without any sort of equipment, right? They just use your body weight, things like jumping jacks, planks, you know, and a combination of those. I have several I've memorized that are about 20 minutes long. So if I'm at a practice or I'm watching my show on Netflix, my living room turns into my gym, right? And you can squeeze that 20 minutes in lunch break, in between clients, whatever the case may be. And you really can do them anywhere. So that's been a saving grace for me. And with 4 kids and, you know,
I love
a life
that.
and all those things.
You do your squats while you're decorating your Oreos. You know?
I mean, air squats are like legit a thing. There are studies that show that it makes a huge difference. So that's not wrong.
I mean, I know
Not
I have to do
at
something
all.
because, you know, like, just in my 30s now, like when I move my arms, when I do lay a different way, I'm like, it hurts. Like, I'm sore in the morning. Like, I never had that before, you know?
Right.
Yeah, absolutely. Yeah, but being intentional, meet yourself where you're at. You know, take what you feel like you could handle and go from there. Okay. You know?
Maybe Jamie and Ammari take a salsa class or something.
Ooh, I like that. Even
Weird
better.
to me to comprehend that I'm like so type A and I want to be so successful at so many parts of my life, but I don't take that seriously. And I never understood why I feel that way. Like I was watching something the other day, well, the Kardashians, and
We love them.
There's the guy that's getting younger. You know, like, like his eyes are really white and he only puts so many only necessary calories in his body. Yes. Like he's like,
Who's this?
it's this guy, like he's gone viral and he's younger than, like his body's really testing as an 18-year-old.
David Asprey?
Maybe. But he talks like a robot and he's crazy and his eyes are all white.
That sounds really extreme. I do not want you to go that direction.
So I'm watching all this, Amanda, on my couch, chugging my ski, eating my Cheez-Its, and I'm like, you have a problem. This guy is only eating necessary calories. He says he doesn't eat after 11 a.m. He does not eat after 11 a.m.
Oh, that's
That's mind-blowing. Right? And they did a shot, what I thought was alcohol, and it was olive oil. I'm like, well, I don't know.
You're out.
Yeah, I mean, but I know, like, no, I don't want to be as extreme as him.
Yeah.
Sure. Yeah.
But I do need to take it more seriously.
Absolutely.
Because I care so much about everything else in my life. Why am I not caring about the one thing that decides how long I'm here on this earth?
Right.
Right.
Yeah.
So definitely glad.
Well, and just like you were talking about, the quality of life as you get older. You know what I mean? Like what you
Precisely.
put in now is how
I
you're
mean,
going to feel in your 70s and
I
your
used
80s.
to like Marble Lights and Bush Light. I did. I liked to smoke when I drank a beer. And my husband said, if you die of cancer and you're not here to help raise these kids, I'm like, I know, like, you know, and like,
For sure.
but that was your 20s.
It changes your perspective.
Now in our 30s, I have to worry about freaking calories and my cholesterol now. It's like, I miss just being able to have a Bush Light and a cigarette. Now you're telling me I can't do it.
Yeah. And in your 40s and 50s, you have to worry about muscle wasting that's going to keep you from being able to get off of a toilet independently when you're 80.
Yes.
Right? Because that's where that muscle loss starts. So, I mean, it's all about formation of good habits, you know, and making sure that you're able to kind of focus on that and to support yourself, because it does. It pays dividends in the long run. What you do now matters when you're 60, right? You know, it may not now. Now you might be able to push through and skirt through, but that's only going to last for so long.
Do you feel like
things start to
this
break down?
Situation, like because of your job, because you see all the time, does it put you down rabbit holes sometimes where you're like, I could keep going and going and going?
Oh my gosh, yeah. Yeah, I mean, there's so many obscure things. And to that point, there's so many influencers out there and so many capitalistic companies that are selling like the secret thing, right? Like, oh, the biohacking thing or this thing that's going to be the secret to longevity or the key. And the reality is there is no secret, right? It is. It is your lifestyle. It is those principles. Can you exploit some metabolic processes by intermittent fasting? Well, sure, you absolutely can. But if you want to eat your arm by the time that your fasting window closes, it's not going to do you any good.
I know. And I don't want to be pissed off.
Get mean.
That's what I'm saying. I'm going to be pissed off all the time.
Yeah,
like, they think my hot flash is bad. Don't let me eat my Laffy Taffy. I'm going to be rocking your, like, makes me super pissed. I eat like a child. Like, obviously. Like, I love sweets and I see that stuff all the time.
And maybe we need to scale it back on that just a little bit.
I know.
Right? Be intentional sometimes.
And you do witness some of that, even at like when we're at those baseball games with our kids. Like, I'm like drinking and I'm eating Laffy Taffies for supper. Like, I do need to.
I think that there's a point in time where you can kind of hone that in and you can try to be dialed in and still live life, right? You know, it's more of an intuitive approach. When your kids want a donut or they want to go to the covered in chocolate bakery on the weekends or whatever the case may be, go. Eat the donut, right? Live that life and engage in those activities. But when you are able to, be dialed in with a nutritional approach that's going to serve you well, right? That's going to reduce that inflammation, that's going to hit those nutritional goals, that's going to support those body composition goals that you might have, and that's going to support a good cardiovascular function, you know? So it's all tied in. And there's the point with all of that tangent and that long explanation, that boring explanation that I have, is that there isn't a workaround. Right. You know, there isn't anything in a supplement form or, you know, in a medication that's going to circumvent the need for a healthy lifestyle and that foundation, you know? So, I mean, it's about being intentional and accepting that you don't have to be perfect, but you can take steps and you can move towards in that direction.
Okay. All right. So, is that your cholesterol under control? What else we got?
Yeah. So your cholesterol. Okay. And then I really, really, really want you to get on a B12 supplement because that is deficient. So B12 is really important for your energy levels, the way your body metabolizes fat, all of those things. So you
mean I can have more energy?
Blood production. And yours is significantly deficient. I'm sorry, I'm going to bust you out here.
Such a bitch.
Your B12 is at a 167.
What should it be at?
And it should be between a 500 and 1,000. And deficiency.
You know what? I'm kind of glad, Kurt, hopefully you're watching this episode because you bitch at me for wanting to sleep on the couch after making dinner. For make these like amazing dinners because he doesn't.
She was being deficient.
Yeah. So why didn't you think about that?
And deficiency is anything under 180. So you're not only not optimized, you are significantly, profoundly deficient.
Okay, so what do we do about that?
So we replace it. You can use a sublingual supplement or a B12 injection to kind of get that more robust, and we can kind of talk about that and get a plan together for you.
I bet you'll feel that immediately. You know what I mean? Like the effects of that immediately.
Absolutely. Yeah. Pep in your step.
My employees are going to love this. I drive them up a wall the way it is, and now I'm going to have more. And I'm excited about this.
Yeah. You might not need to lay down and watch an episode of your Netflix show and drink ski. You might be like, I'm going to clean the house. I'm going to go be productive. Yeah. Right?
I mean, and how does it become drastically that low? Like what,
Yeah, so there's a lot of different things. Some people don't absorb B12 well. Sometimes it's just lacking in our diet. So, you're just probably
Where can I naturally
not
get my
taking
B12?
in enough of it. Yeah, you're going to go there, and I'm just going to kind of move past that, and we'll fill that up afterwards. You need supplementation.
Okay.
Yours is dramatically low. You will not get enough through your diet.
Okay. All right. So you guys heard that. I have to
So
supplement.
as much as I would love to say
Eat
just
spinach.
eat more of these. Yeah.
And I'm like, that bitch over there was like,
It's not gonna happen.
That's great.
No, I'm telling you, it's been a journey. The last year has been a journey of going, and I got B12s every week. Shots.
Okay.
And same for D and all that jazz. So,
So Mari was just already on top of it.
Yeah,
She
so
was
I need to
ahead of
get-
the game.
Yeah, okay.
Yeah. So then your vitamin D is also a little deficient. So your vitamin D should be above a 30, ideally about a 50 to 80. So anything under a 30 is deficient, you're at a 20. So we need to supplement vitamin D. That's going to be oral. I get asked all the time, well, the sun's getting ready to come out. Isn't that going to be enough?
No.
It's not enough. You're deficient. You need to supplement.
And
You need to get that more
what's that
robust.
going to make a difference in? What does vitamin D do to me?
So vitamin D is really important for hormone function. Its claim to fame is bone health. It's really critical for your bone health, but it also influences mood, energy levels, and is a really important one to replace. So definitely want to get that a little more robust and certainly out of deficiency. Looking at the rest of your labs, your hormone labs, so your testosterone is a bit low too. Yours is at a 37. Again, anything under a 50 can be causing some degree of symptoms. 80 to 100 is going to be my target range or that optimal range for replacement. So that's a possibility for you as well. Looking at your progesterone, your estrogen, luteinizing hormone, your follicle stimulating hormone, those are all in what would be considered quote, quote, normal range. So do we need to take action on those? Not necessarily, but if you start to feel symptoms or I have people ask all the time, like, how do I get ahead of perimenopause or get ahead of menopause? Well, you kind of listen to your body and you listen to your symptoms, right? And you communicate that with a provider that's willing to and open to providing hormone replacement for you. So things like increased anxiety, increased irritability, insomnia, the hot flashes,
all those
the night
beautiful things are
sweats.
happening.
Yeah, PMS, low libido. All of those are nuanced symptoms.
How do you make so we're sleeping less. Mm-hmm. We're definitely dealing with weight more than we ever have.
yeah,
We're
stress.
sweaty, stressed. How do you keep your sexual wellness up? Like, how do you keep
question.
your sexual drive up with all of this stuff going on and not want to stab your husband?
Yeah.
That's what I want to know. Like, how do I make sure, because obviously...
You stay connected.
Yeah, that's
Yeah.
a big one, for me with all the kids and the work. I obviously sex is his love language. So how do we keep that up and keep that going?
Yeah, so libidos are multifactorial, right? And especially libido in female patients. So, your relationship status, whether there's stress with the kids, whether you're feeling overwhelmed, that's all gonna influence your desire to be intimate, right? There's also physiological things that can influence that desire, and testosterone is the major player there. Though estrogen and progesterone both play a role in a woman's libido, testosterone is the key.
Okay.
So oftentimes we'll look to testosterone to kind of say, yeah, if those levels are a little lower than optimal and we're feeling that lower libido or we don't have a robust or satisfying spontaneous sexual desire, then we can replace testosterone as an option. It's not the right option for everyone, but it's a good starting point. Once we get those levels to optimal, you can really better assess whether anything else is going on, right? So you have to have that physiological foundation in order to have a healthy libido. There's a lot of other options for libido too if testosterone doesn't work for an individual. There's things like Addy, bremelanotide, oxytocin, even Viagra and Cialis can be used
For
in
females?
patients, for female patients. Yeah,
I did
who
not
are
know that.
experiencing
No. Okay, so they would take the male Viagra?
Yeah, so we usually will use a little bit lower dosing, but yeah, kind of the same way that it works for erectile dysfunction, improving blood flow and helping the ability to achieve and maintain an erection, it can help to improve blood flow to the clitoris, which can improve the ability to achieve an orgasm, improve stimulation, and when you find sex more satisfying,
Hey, you want to do it more.
Yeah, you're more likely to engage in it, so it can be stimulating and help with libido in that way. So
Very interesting.
particularly in
Get
women
like
who
the
are on
dudes. Yeah.
I know, right?
Yeah.
It's very interesting.
Yeah, so there's lots of different options. It's very rarely a one size fits all, and it's very rare that, you know, everybody needs the same thing.
Yeah.
You know, sometimes women are on an SSRI or some sort of an antidepressant, and that will, you know, kind of squelch your libido. Viagra and Cialis are a really great option in those patients. So it really just kind of depends on where levels are and kind of what the actual situation is and what the desired outcome is.
And again, I just love the customization. Like you said, it's not one size fits all.
Yes.
Like, I love that.
Yeah, we're all very unique. Very unique.
So
all little Rubik's cubes to
So
put
when
together.
we would come back, you come back, each time do you check the blood work every time to see how things are improving?
Yeah, exactly. So each time we usually will follow up in 3 to 6 month intervals with patients who initiate therapy. We recheck labs, and then we reevaluate where you're at with symptoms. If we've seen a significant improvement in symptoms, but we haven't seen much change on the blood work, great. Let's leave it alone, right?
Yeah, right.
Conversely, if we haven't seen much symptom improvement, but we're seeing progress on the blood work, well, we probably need to look at other modalities to help treat that, you know, and do some fine tuning. So definitely constantly evolving, you know, and following up routinely. And lots of really good communication to figure out exactly what the right mix is for each individual.
I love that.
I do too. I mean, I'm a little like, oh gosh, I hate that I'm on that stuff so low.
No, but now you know where we need to start. And same for me. It's like,
No, I know.
I'm like, okay, we have where we need to start, and now we can make
Get a
the
plan.
progress. Yeah, yeah. And you're going to just be able to perform for your business, for your family.
Oh, I know. I agree.
for your
It's definitely
community so much better. You know what I mean?
Yes.
It's like you were talking about when we came, pouring from that empty cup.
Yep. Yeah, you can't pour from an empty cup. You can do anything, but you can't do everything.
yes.
You know?
There you go. Yeah. Well, thank you so much. I mean,
Welcome. You're
No,
welcome.
This was so informative, and I mean, I think we had like all of. I mean, do you have any other further questions? I know you were so.
Usually it's like, wait a minute, pew, 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 pew. It's usually a bunch of questions triggered,
Yes.
but I think you guys did a good job of asking them as we went.
I think so too. I think I got a lot of things answered and stuff I was curious about. Is there anything that's unique to this office that you guys do that I couldn't get somewhere else? Like what sets you apart?
Yeah, so I mean, I think it's time. You know, we work outside of an insurance model, so we are concierge. We don't accept insurance, and for some that seems to be a barrier. But our pricing for appointments is very reasonable. But that affords us the time to be able to really dive into women's needs, their concerns, and to really you can't get that in primary care. You know, your primary care would love to sit and go over lab results like this with you and talk about all the nuances of how you're feeling. But the unfortunate thing is that within our current healthcare system, they can't. They don't have the time to be able to sit down because, you know, reimbursement with insurance is so low. And I think that that's kind of what sets us apart. You know, your GYNs, they want to be able to help you, but oftentimes they just have those time constraints that they can't. And being outside of an insurance model has afforded us that opportunity and that luxury of time to be able to spend with each individual.
So important. I did think of a question.
Yeah.
What would you say is like your go-to self-care, maybe ritual, or like one thing that you've been prioritizing?
Magnesium.
Really?
So yeah, magnesium and the way that it has improved my quality of sleep. So yeah, I mean, it just really does help with, for me personally, and my magnesium levels weren't robust when we first started checking my labs, and it's really helped me to be able to be less anxious, less intense, get a better night's sleep, a little less tension. Progesterone has been the other savior for me. I mean, I think that, you know, a year ago I was not on progesterone at that point in time, and I was really starting to notice some of the profound symptoms associated with progesterone deficiencies or progesterone levels being inadequate. I was irritable, I wasn't sleeping, I was having night sweats, all the things. It was like, oh man, already? But it's been a game changer. You know, even my kids have noticed a difference just in how I interact with them, and that's been really amazing. You know?
Are you a good sleeper?
No.
I'm
like 1 o'clock in the morning, I'm like up. And thinking about stupid shit. Stuff that shouldn't even matter. It's like your mind's racing and you just can't shut it off.
Yeah. I'm not a good sleeper either. I'm terrible.
We've got just the things.
Yeah, and I'd be interested in like the anxiety thing, just because it's like stuff, you know, like I've always had big jobs. That's always what's drove me. Like I always want something bigger, better, something more that's going to stress me out so I can accomplish it. But now it's like it weighs on me so much. Like I feel like my stomach hurt. Like, you know, like every time before anything, you know, and it's like it's out of control. I can't stress that much.
And it's new. Right? It's not something it's progressively worsening and it's new. And that's an indication that something's shifting, right? You know, for those that they ask, oh, well, when is it time to start hormone replacement therapy, or when do I start to think about, you know, interventions for these things? And the answer to that is super individualized, right? It's when those symptoms that we deal with every day, it's hard to distinguish. Is it the kids? Is it my job? Is it, you know, this? Is it that? When those symptoms feel disproportionate, or when they are bothersome enough that they're affecting our everyday life, let's try it. Let's give it a whirl. Let's see if these options can help, you know?
Yeah.
They're not permanent.
Right.
So if they help, all the better.
Yeah, definitely. I think you do a good job making people not feel like me, not feel insecure, because I'm a person that I do not like I don't want to know clearly when you're oh geez.
Yeah.
You know, like I'm not one that likes to face stuff head on. I feel like you helped with that, make it easy.
Oh, you know what I have appreciated, because we kind of talked a little bit about social media, and you are kind of bombarded with all of this information. Oh, go here, do this, do that.
I know.
And I love just how specific you were with us, and I just felt like really cared for, really taken care of. Yeah, it's been wonderful.
Hard to sort through what's beneficial and what's not, because there is a lot of noise out there. You
Well,
know?
and I feel like, and safe. Some people like take things online, and I'm like, this is crazy. Is this regulated? What's going on
Probably not.
Am I really gonna look like that when I'm done? I love whenever they put the cream on, the wrinkle disappears. I'm like, does that really happen?
You're right, yeah.
What kind of jelly, what kind of sorcery is in
Yeah,
there?
what
What
is in
filter
this?
did you use?
Yeah.
Right?
So, don't DIY it. Come to Embody Her.
Yeah, we loved it. We love Amanda. It was a great experience.
The moral of the
beautiful.
story, yes.
yeah.
Do not DIY your health. No, you need an expert
Stick
for
to
sure.
the experts.
Just like I will never DIY cookies.
yeah, she's the best, isn't she?
Just don't eat too many, or you'll be in trouble with your cholesterol.
Right, yeah. And Jerry Wincey.
You know what, though? I mean, naive of me to think that I could continue to live that lifestyle and not catch up with me.
Yeah, I mean, your body changes. As your reproductive health changes, your metabolic health changes. You know, it can't keep up.
No.
So,
Time to grow up.
Yeah, we're
36,
catching it
no more.
now. Yeah.
but
You
I
can
also
still have a
think,
treat every once in a while. Yeah.
yes,
Every once in a while.
yeah.
Yeah. Do you think you have, like, since you, like, have you cut all your sugars out? Like, have you changed your...
No, have I cut all sugar out? No, but just like severe, heavy multivitamin supplementation, and making sure I try to take it every day, because I think my vitamin D was an 8 last year.
Oh my goodness, girl!
So I had to go in every week and get injections every week. It was so low, and that's why I said when you start this, you're gonna immediately feel better. It's like. I'm a pretty bubbly person, so I don't know. I like struggle to say like, oh, I was depressed, but you just feel like low energy. You're like not excited to do anything, and lo and behold, it's like your vitamin D and your B12 messing everything up.
Yep.
So it has been a journey for sure, but I'm feeling better. You know,
better.
my knees hurt less, and I'm feeling more energized and more, positive. But so I'm really excited for you, and I'm excited for me. Like, question. Sorry, last question. Fish oil. You recommended that for both of us. Do you have one that doesn't make you burp?
Good question.
that
Yeah.
happens?
So our formulary is
That's the reason I don't
broken
take
down
one.
so that it does not do that. So yes, we have a really good version of
When you
fish oil
burp, it tastes
because
like fish?
supplementation is not
Disgusting.
all created equal. It is like the wild, wild west. So you want to make sure that any supplements that you're taking, they should not come from Amazon. They should be pharmaceutical grade supplements. and those really crappy ones are going to not necessarily have absorbable versions of the vitamins and minerals that they contain. They may have contaminants, so it's really, really important to get high quality supplements. They may cost you a smidgen more, but you're going to know that you're actually getting high quality supplementation.
Yes, and that is one of the reasons that I could never take it, because it was, you would burp up fish all day.
It is really common with some of the yucky ones. Yeah, I've read horror stories about some of them being like rancid and
don't get them off Amazon.
No, only high quality supplements on our wellness journey.
I mean, I don't think, like, would you have thought about that? No. That was a good one. I don't think I would have thought of that.
Yeah. Well, now you know.
Now I know. There we go. Awesome. Well, thank you so much.
Yeah, thank you guys so much for coming in today. It was great to see both of you. Great to chat.
Yeah.
And thanks for highlighting women's health and wellness.
Yeah.
I really appreciate it.
Me too. So good. Yeah. James walked in one. Have you watched it? No?
Oh my goodness. So beautiful.
Okay, so it's right in here. These little like secret Parkway we work here. They feel like so swanky.
How are you?
Should we work right here?
More sessions. Whatever you like.
When you're representing, like, what is the business to you?
It's a clinic. It's a wellness clinic.
Okay.
We focus on longevity. We focus on hormone therapy, sexual wellness, really kind of the missing spots that women don't get managed in their primary care or even gynecologic setting. So we're kind of taking over that part of it because it takes time for those kind of appointments.
Yeah. And what do you feel like what need are you fulfilling the most? Like, what are you seeing that women are lacking or needing the most from you guys?
I think a little bit of all of the above, right? I mean, women's needs and, as you enter kind of this era in life are complex, and it's oftentimes not just one thing that's missing. It's often a myriad of things. You have a lot of different symptoms that are happening. And sometimes there's one thing that's missing, but often it's just kind of accumulation of a lot of little things, that need to be addressed and need to be addressed.
And being we're really great listeners. I think that's something we really harp on, but our staff, everybody makes our patients feel seen and heard.
Yes.
Women frequently are gaslit.
Well, and it's nerve-wracking coming there. I was nervous.
Oh my gosh, totally. It can be a little intimidating. You have really kind of no idea what to expect. You're used to being tossed around from other doctors' offices and walking into dungy, kind of depressing offices and not really knowing what you're going to get and crappy staff and all the things. But our staff tries to really make everybody feel seen and welcomed. And comfortable talking about what brings them in, so that when Amanda and I go in the room, they're already relaxed. They're already
feeling at
ease. I'm being heard. Somebody's going to listen to me.
Yeah.
And that's probably one of the biggest
you have
things.
the happiest staff I think I've ever met. And seriously, from the time we walked in, seriously, the front desk, they were so happy to to meet us and see us. And then from getting our blood drawn, she's like, I just love changing women's life. And it made me emotional. It made me emotional talking about it, saying in the interview. That's just such an amazing thing.
Yeah.
Right.
It's been the biggest piece to the puzzle. Me and Amanda and I have worked in healthcare for years, and we're used to working in stressed out environments. Everybody's overworked. Everybody's stressed out. Yeah. It's not their fault all the time that they're so crappy and miserable. But we wanted to have an environment where everybody is happy to be there. Where everybody is on the same mission to support women, to have a good, healthy life themselves. That's been really a big part of what we wanted to accomplish. So whenever I hear good things about the staff, I'm like, it makes me a proud mama, because it's that was the whole point of all of this, was to have really happy, healthy staff members that, reflect what we all want to kind of aspire to.
And you feel like they live what you guys preach, they stay up on it.
Oh my gosh, yeah.
Oh, it shows, for sure.
Absolutely. And, it's empowered women empower women.
Yes.
Right?
Yes.
You start with making everyone around you feel better, and it's contagious.
Right.
Yeah.
So that's such a good point. So we did get to hear a little bit about Amanda's background. Maybe we could hear a little about you.
Totally, yeah. So I was originally, and still am, an internal medicine doctor. I've worked in pretty much every aspect of internal medicine. But I started out in hospitalist medicine, where I worked in the hospital setting, admitting patients from the ER to the hospital and managing hospital patients. So pretty sick, pretty acute. And I transitioned into nursing home medicine for a while, which really kind of kickstarted my interest in longevity, because you're seeing patients at the end of, life, really, and how they lose their independence, and how a big part of that is that lack of muscle and lack of energy, really, when you get towards the end of life. So that really kind of kickstarted my longevity approach. And then I went into primary care, which Amanda was in prior as well. Yeah. And that was just the grind, where you're seeing the 20, 30 patients a day, in and out, in and out. You don't have that great amount of time to sit and have a really serious conversation with your patients about hormone therapy, about even wellness in general.
Yeah.
It's really, there's too many clicks to
It was
click.
so nice. Like, I felt like it wasn't rushed. You really took your time with it. And I was like, this is how a doctor's appointment should be.
Yes. And I guarantee you, your primary care agrees with you.
Yes.
They wish that they had that time.
100.
They just don't have that luxury.
Yes.
Right.
Yeah, they're under a time crunch, and it's a more insurance-based model, and so I really wanted to do something different with my next step in medicine. I knew it required time. I want time with my patients. The women want time, so it had to be more of a concierge approach to that. And so, I reached out to Amanda and was like, I had this harebrained idea. I have a friend that can help us get this going. And she was all aboard from the very beginning. I'm like, this is going to be crazy, but if it works, it works. And it was always, if Amanda couldn't do it, it wasn't going to work. I knew that was like the biggest piece of the puzzle to get this going. So absolutely, a lot of different avenues, but I think it's helped to see all those aspects of healthcare. And then I have a good knowledge base, and so does Amanda, of what other problems patients have and how that ties into their hormone therapy, how it ties into their sexual wellness. We know a lot about all the basics, the depression, heart disease, diabetes. That's our bread and butter. So we're really comfortable knowing how to approach those patients and how to get their wellness, in a more longevity approach versus just a Band-Aid, kind of approach.
It's amazing to me how many people love you. So I Googled, obviously.
Yes.
We
love Google.
So, and I don't, because I'm a freaking 4.6 and you guys are a 5.
Yeah.
194.
I don't love Google for that.
Yeah.
100. I know, but
We'll take that.
But 194
You guys are changing
ratings
lives.
of 5-star. That's amazing. I told her I have an employee, and she's like, "Oh my gosh, when do you go to Embody Health? I have a gift card," and she was so excited,
That's awesome.
celebrity status,
Right.
just
I love it.
love what you're doing for women and that you're touching all their lives.
That's so great to hear.
Do you feel like when you were in the nursing home facilities, do you feel like it scared you a little to see how our bodies end and how we deteriorate? Was that a little bit of a shock?
I think so. And also seeing, the American healthcare system is not set up well for our future. So I really stress to my patients, you've got to take care of your health as much as possible to hang on to your independence, because this healthcare system isn't really there for you when we get older. Even the hospital system, you hear of 3-4 hour wait times in ERs for chest pain. A 60-year-old is like, that's not acceptable, but that's the model. So it's really important to do everything we can to take care of our health now, so that we're not needing somebody else as much as possible in the future. At some point, we're all gonna, have an end, but it's a nice idea to have it kind of be an abrupt end versus this dwindling for 10, 15 years with lack of independence, lack of good health, quality at the end. We can't. So,
on that note, what would you say is one maybe ritual or something that you've implemented in your life to make sure that you are taking care of prioritizing your health? Because you're busy. You ladies are busy.
Yes. So
Amanda already shared hers. She said magnesium. That was a game changer.
That's a great one. I was going to say sleep is absolutely what I was going to say. I really think I used to approach, you go through medical school and residency, you're championed for not sleeping, right? The least amount you can sleep, the better doctor you are. Yeah. So it was a goal to be able to function on 30 hours and still be on your A game. And so once I got more into this, I'm like, sleep is so important, you guys. If we can all make the time for it, it just requires really abrupt stops. I can't watch 3 hours of Netflix. I'm gonna have to go to sleep at a reasonable time.
Yeah.
So really, sleep has been my biggest priority more than anything.
And what's reasonable for you? What is a reasonable evening?
Yeah, so definitely a solid 7.5 to 7 hours of sleep. I wear a Whoop usually. I'm not wearing it today because it smells but it tracks my sleep. I sleep throughout the night and gives me my feedback on how much quality deep REM cycle sleep I got. So it's really the quality sleep that matters. So
Yeah.
I make all the efforts I can. I used to be the biggest night owl, stay up till 1 a.m, get up at
that's
6, you know, just like function.
I'm like
5
answering
hours.
emails. It's quiet. I'm like
100. Yeah.
oh, just let me knock out one more thing.
Yeah, right. You're like, I just need to do one more email. I need to do one more, but at the end of the day, it's like I won't be
I
functional.
put it on a time, like I make it send for a normal. I don't email you at 1 a.m.
I'm just rude.
That's
doing it.
crazy.
Like, I know
Oh, me too.
me
too. Yeah.
Hopefully you don't have a lot
I'm just
set
gonna.
up.
I know.
I'm just gonna say like
Notifications. Yeah, for sure. Yeah.
Thank you so much.
Bee's knees.
Okay, so tell me what's in it, right? Can you tell me about it?
Bee's knees is a gin
So
cocktail.
pretty.
So that uses a floral gin called Hendrix.
Oh, thank you so much.
I use a honey simple syrup. So we boil honey off with water
Oh
to
my.
make a simple syrup.
Oh my gosh.
And a little bit of lemon juice. Very standard drink. This is your
I'm so
smoldering
excited.
Thank you.
Spicy margarita.
Delicious. That big ice cube. Oh, is that the big ice cubes?
Yeah, they're
Fancy ice cubes.
French martini.
Oh, okay.
Oh, you switched it.
That's okay. Yeah, I'll drink
We're
the
gonna
French
enjoy that
I
French
did
martini.
switch
It's gonna be
it.
delicious.
Sounds great.
Oh my gosh, I'm
love
so
that.
sorry.
Yeah.
Oh my god, it's so great.
Yeah. Well, thank you guys for tuning in. Do not forget to like, share, subscribe, and talk to you later.
Cannot wait to see what she does with my nails. Hello.
Oh my god. How are you guys?
Great.
Okay. So I think I want to do airbrush first.
Okay.
And then everything's by accident. Didn't want it. But I got it.
Yeah, now you use it. Yeah. Whenever she gets done, we need like a boomer.